Hello and welcome to Seven Sentinels. This is Grand Master Class and I am Peter Simon with you. Today we are conducting speaking sessions and we have here with us Sreedhar Bommineni from Freeport, Bahamas, originally from Tirupati, Andhra Pradesh, India. He is preparing for his medicine-specific occupational English test. And this is the speaking warm-up session scheduled for today. Hello, Mr. Sreedhar.
Hi, good morning. Thank you for having me.
Yes, these are the daily dosage profession-specific speaking materials and medicine profession-specific speaking tasks. Mr. Sreedhar, can you please tell me something about yourself in 3 to 4 sentences?
I'm Sreedhar Bommineni. I'm an emergency medicine specialist working in a beautiful country called Bahamas. I have more than 16 years of experience in emergency medicine and 20 years of experience in medicine. So far, I worked in more than 5 different countries and exposed and enjoyed different cultures, multi-diversity, and different health settings and different health systems. And concerning, I'm very proactive team leader and accepts constructive criticism and always believe that your hard work will pay you back. And during my leisure time, I would love to spend time on white sand beaches with the clear blue skies. And in leisure time, love to enjoy by doing cooking and jog.
Right. Why did you choose medicine as your profession?
The reasons for this is medicine profession is one of the noble profession where you get immense satisfaction by treating people, especially those who are in need. You're going to help them. At the same time, it's a challenging field too because it's the place where you have to apply your knowledge, your experience to treat the patients. Unlike machines, human anatomy is completely different. Even though it's the same complaint, headache can present in the same person different times in different ways, different causes. So you must be so accurate to know what's happening with your patient. And also just not giving treatment, there's so many other aspects concerning in this one.
What is your fundamental reason for taking the occupational English test?
The reason for this one is I got a fellowship in emergency medicine in UK. To pursue the fellowship, I have to get an English test to join the program, and also like UK is one of the best place for especially for education, so I opted to do it in there. Yeah.
Which country is your most favorite destination for migration and work?
Without any doubt, America is the number one because the laws are very strict and also it facilitates for so many kinds of immigrants, especially if you have talent and there's so many jobs. The field is extraordinary, like it's a big, huge field, and opportunities are a lot opportunities you have, and the exams are more approachable, more practicable, and of course it's the most developed country in the world. At the same time, um, this the quality of life is much better than anywhere in the world.
Yes. Which country is your most favorite destination for migration and work?
um, Currently UK is one of the best place because at the same time you have where you can get education along with a decent amount of money. I would consider UK is one of my favorite place too, because the way of teaching in UK is, I think, is outstanding. They start to teach from the basics, and they'll make sure that you won't do any mistakes. And financially, is one of is it may not be the best, but still it provides a decent amount of money, and the quality of life is also extremely good. So I think UK is one of my favorite countries.
Right. Comment on the special qualities of the contemporary or the present generation doctors.
So the qualities of contemporary doctors, the special qualities you must have is first effective communication, because you have to communicate what you think about the patient, what the patient needs, and what information are you giving. You should be specific and avoid medical jargon. And second one, you have to show empathy, because most of the time when they come to hospital to see you, they're in pain, they're in agony, they need help. So you have to show the empathy, understand their feelings, and console them. And the third one, you must be honesty. You must be honest. You cannot cover up the facts. You have to inform them, wait for the breaking bad news, and wait for the reaction, and then console them. And fourth one, you must be knowledgeable, and you have to be up to date with your knowledge and the latest guidelines. And hardworking and is important in this field.
What is the regular routine of an ideal doctor?
Ideal doctor routine is, yes, you are like my job, or like any other doctor job, starts basically by handing over from the previous shift, and then check whether, like, if there are any other emergencies or any sick patients waiting to be seen, and go and talk to them, try to help them, try to get the help what they require. And then, the new patients, they're waiting to be seen by doctors, you go and see them one by one, and then try to organize them and see them quickly so that they can go home. And third one, and you always be always be more specific about the symptoms and signs, because as I earlier told you, right, even the same complaint, same disease can present in different ways. So you must be always on your toes, especially when you're assessing the patient, and follow the routine guidelines, and standards of care is important.
Yes. As far as your profession is concerned, who is your role model?
Personally, I don't have any role model, because when you realize what you're supposed to do, what's your job, and what not to do, so then you can decide, like, once you know your duty, your job, so just stick to them, do your job properly, and avoid those mistakes, and you know what not to do. So once you do your job properly, you don't need no role model, because by admiring somebody as a role model, you try to follow with them, but you don't know, you only see the positives of your role model. You never see the negatives or the other feedbacks, false. So it's better for you, you're the best person to judge yourself than you judge somebody, their role model, and follow with them. So this is my opinion, because the best person to understand, to know is about you is you. So you know your strengths and your weakness. So I think there's no role model for me. I just follow what's the best for me and what's best for the patient. Always try to stay away from the mistakes. That's all.
Yeah, that's very nice talking to you. It was a good warm-up speaking session, and I really appreciate it. I really appreciate your speaking style. You're doing well. That's really commendable. Thank you very much.
Thank you very much, Mr. Peter.